Have you ever wondered about the evolution of medicine? Well, today I'm here to discuss the birth, the foundation, and the revolution of modern medicine. Medicine was pure trial and error when it first started. I personally have always loved learning about the history of medicine and how it became to what we know it today. In the beginning, according to Rachel Hajar, author and doctor of cardiology, we first see medicine happen through the Egyptian times. We see the first medical procedure happening in the Egyptians, and we call this trepanation. And in trepanation, it is a procedure where you drill a hole into the human skull, and this is believed to release evil spirits, migraines, mental illness, and even cure fractures. We see the first medical text used by the Babylonians under the code of King Hammurabi. And what these texts were, they were laws that the patients and the physicians had to follow, and even how much the patients had to pay the doctors. We see the first real-life quote-unquote doctor. His name was Hippocrates. He is known as the father of medicine. We still use some of his skills today, one of those being assessing the symptoms of a patient and giving them a future outcome or prognosis, if you will. We still use that today, and that is something that he created. In the foundation of medicine, we see inoculations, vaccines, and surgeries. We see the first inoculation used by Edward Jenner when he took the infected cowpox blister and rubbed it on an uninfected patient, and thus inoculations came to be. And then according to immunization.org, we see Edward Jenner successfully complete the first vaccination when he vaccinated a 13-year-old boy of cowpox. And we certainly do not see vaccines stop there. And again, in 1923, we see the first tetanus vaccine created by Alexander Glennie. Surgeries were a big part of medicine, and we first see surgeries happening through the Egyptians' times. But according to Shelley McKellar, professor of the history of medicine at the Western Ontario University, we see surgeries happening at the site of the battlefield in time of war. Surgeons were particularly barbers that accompanied the military to help with the battlefield of wounded soldiers. This is actually how the first stab wound was treated. Now, in the revolution of medicine, we see in the birth of electricity, we owe electricity through all the things that we have today. And according to Gandu Rao, a medical engineer in the state of Karnataka, India, we see in the last half century, because of electricity, we see the birth of pacemakers, electrocardiograms, tons of imaging technology through the birth of electricity. And without electricity, we could not do important procedures, one of those being organ transplants. According to Thomas Schlick, the author of Organ Revolution, we see the first idea of an organ transplant happening in 1894 by surgeon Otto Lenz. But we don't see the first successful organ transplant until 1954, completed by Dr. Joseph Murray. Now, with organ transplant and electricity, we see the impossible happening through test tube babies. And now, in today's time, you can conceive a baby through medicine. And according to Dr. Maureen Baker, the chair of the RCGP, we see the first test tube baby born in Britain in 1978. And through this, we see the birth of in vitro fertilization, egg implantation, and many other devices that help you conceive a baby without even conceiving. In conclusion, we see vast changes in medicine through this time. We see through the birth of electricity so many procedures and tools made that we possibly could not live without today. Today, I have discussed the birth, the foundation, and revolution of modern medicine, and I'll leave you with this quote by Dr. Bernard Lone, the inventor of the cardiac defibrillator. Do as much as possible to the patients, but as little as possible to the patient.